Brian Wagner is one of the 900 amputee patients from the wars in Afghanistan and Iraq. Most injuries can be treated quickly, but there are some haunting side effects. Wagner was injured by an IED while serving in Iraq. He lost part of his right leg, but the pains linger.
I feel like I was getting stabbed like in between my toes, like with like a knife, like like a poker, or in the arch of my foot or the heel. The more like annoying ones are like when your big toe's crossed over your second toe, or like when you cut your toenails, there's like a little sharp spot, and you put a sock on it, like pulls your toenail back like that.
Phantom pain in general will dissipate over several month period, but in some people it actually lasts for years to decades.
The cause of phantom limb pain is still unknown, but there is new treatment to make this pain go away.
What we've been offering to some of the patients in our clinic here is something called mirror therapy. At the beginning of therapy, they take off their shoe and their sock and then place the mirror between the legs and then move the foot sort of up and down like they're stepping on the gas pedal and lifting off.
It literally feels like you're moving your foot. Like it feels like your foot is there, like the reflection and just the way you move it and everything. It's nuts.
When the patient uses the mirror and looks into it and sees the reflected image of their intact hand or foot, they think that it is the amputated hand or foot returned. By doing the movements, you're basically either quieting down excess activity in the brain, which may be generating the phantom limb, or you may be wiping away any bad memories of that limb.
Veterans say the treatment is working. Mirror therapy is now offered routinely to lower limb amputees at Walter Reed. Dr. Zhao says it may work better than conventional pain medication for people who want to stay active.
So we're convinced that the mirror is what is actually treating the pain, and it's the visual component of this therapy that's actually modulating pain response. You have young men and women, and they were very active before their injury, and so you want to get them back to the point where they actually can do everything they did before and hopefully even more.
Wagner says he's almost there.
After I got it cut off, I was worried about that. I couldn't do all the things I used to do. But then once I started getting more active, and I don't know, I've never stopped.
And Wagner says he won't stop anytime soon. From Washington, I'm Walter Morris.
Yeah, exactly. Maybe we can go get the still photographers right now.
But now moving on to the virtual treatment that's transforming the lives of people who've lost a limb. When someone has an arm or a leg amputated, they can suffer from crippling pain because their brain believes that it's still attached.
Scientists at Manchester University are using computers to give back patients their arms or legs, albeit inside a virtual world, and train their minds to stop the pain. Claire Ashforth went to find out more.
It's 14 years since Peter Smith's arm was amputated. Yet today, like many other amputees, he can still feel crippling phantom pains in his missing arm.
Well, as far as I'm concerned right now, I've still got, I've still got a forearm and a wrist and fingers, and they're not there, but my brain is telling me that they are, and they're trying to move my fingers, trying to move my wrist. My wrist feels as if it's got a strap really tight round it and causes my fingers to swell.
Known as phantom limb syndrome, this is a common condition for up to 80% of amputees. But in order to deal with a phantom symptom, experts have turned to a virtual solution. By putting on a set of glasses like these, scientists have been able to create a virtual limb that amputees like Peter can not only see, but can also move. And the results are astounding.
As I'm looking through that visor, it's my left arm that's moving, but it's actually my right arm that's touching. It's making my arm think that it's actually working and doing something.
What we do is track the position of their remaining physical limb and mirror the movement of that onto the virtual limb. You move your hand to the right, your other hand moves to the left.
We are trying to do is induce sensations of movement, and there's some evidence to suggest that visual therapies such as this reduce phantom limb pain.
It's my left arm on the screen that's actually doing this, and it's giving me, I guess it's taxing my brain a little bit, it's getting my brain to think about what to do.
And whilst this may be a virtual treatment, the results are clearly very real. Claire Ashforth, Granada Reports, Manchester University.